Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Proxyl interlude or Proxyl intermission. This audio podcast as part of a Cataclysm Chiasma. This audio podcast as part of a Storm Robotics Storm Robotics as part of a Storm Robotics production. So in this sort of Proxyl interlude, this intermission, a little bit around the sort of the requirements where patients who are patients or recipients suspect or at risk for hematuria. This sort of interlude a little bit around sort of the requirements for suspect or risk patients, and in line with in line with sort of general in line with sort of a basis around general practitioners or general practitioners or sort of primary care. So one of the main aspects is that a managed primary contact with should be a managed primary contact with recipients or patients who have sort of genital urinary problems. Know that males may be both reticent or less sort of articulate about health than females in around sort of conditions around the urinary tract, and describe sort of strategies to compensate for this during sort of discussions with primary healthcare teams, and also where one of the sort of other sort of bases or requirements is to describe particular difficulties that for example, young adults, and those from particularly or specifically around male backgrounds have when assessing or going through sort of primary care services, primary care services, and also sort of demonstrate a sort of a non-judgmental and caring and professional sort of basis to minimize sort of the minimize sort of any hindrances sort of where primary healthcare teams should or can sort of utilize sort of discussions with infrequent sort of infrequent sort of visits, which offer opportunity or opportunistically offer opportunity and are opportunistic for in around sort of the healthcare sort of education around sort of around the urinary tract, and also know how to evaluate the effectiveness of primary care service or primary care sort of service or services provided to provided and from different patients sort of perspectives and sort of points of view. So that draws this interlude to a close. This has been an audio podcast interlude as part of the Proxyl interlude or intermission. That's audio podcast as part of a Cataclysm Chiasma, and this audio podcast as part of a Storm Robotics production.